Welcome back. I'm Dr. Drew Ramsey from Medscape and Columbia Psychiatry. And today we're here to talk about first episode Psychosis and effective interventions with Dr. Lisa Dixon, who is a professor of psychiatry in our department, as well as heading up the On Track program for New York, as well as being the director of the Center for Practice Innovation. Dr. Dixon, it's really a pleasure to have you here with us.
Oh, thanks. I'm glad to be here.
Let's start out talking about first episode psychosis. And as a clinician and as a researcher, what are the things that our colleagues in psychiatry need to be thinking about in terms of how to be most effective?
Well, we're in a new world right now, in the world of schizophrenia care. When I was trained, and also, frankly, when my brother got sick with schizophrenia, there really wasn't much in the way of hope. It was an illness that in some ways you were sentenced to a lifetime of disability. And what's really exciting right now, because of developments both in science and advocacy and policy, is that we are now living in a time of hope, where we can deliver evidence-based approaches for young people who are early in the development of illnesses like schizophrenia. And we know that there are sort of two things that we need to do, okay? One is we need to get people treatment as early as possible after the onset of psychosis, okay? And that's called, we have to reduce the duration of untreated psychosis.
So often we meet a young individual and they're struggling with the reality testing or with some psychotic symptoms. It feels as clinicians sometimes we're hesitant to say that word psychosis because it's not going to be a diagnosis that's filled with hope.
Yeah. Well, and that's part of our job right now, is to change that, is to change kind of the air, the ethos. You know, we have to help people understand that people can live fulfilled lives. Now, and I'm not saying that we should always be careful before we make any kind of diagnosis or label any symptom. Of course we should. But we also need to recognize that if we leave psychotic symptoms untreated, for an extended length of time, and we don't, it could actually cause people to have a worse prognosis over time. And we know there's a very robust association between duration of untreated psychosis and outcome. The longer the duration of untreated psychosis, the worse the short-term and long-term outcomes. So think about it. If we don't treat people, then it could really have a long-term impact. We have to do it right, and we have to do it carefully, but we have to do it.
Well, tell us about treating it right, because your intervention, medications, which is usually when we think about psychotic illnesses, that's where psychiatrists, that's the first thing that pops into our heads, but that's just one piece of the type of intervention that you have evidence for really is a game changer.
Right. So let me just say that I'm going to be summarizing very briefly the work of many investigators and the contribution of many people with schizophrenia and their families all over the world. Okay, so this has really been something that has been worked on in Australia, in UK, in Canada, and in the United States. Okay, so what do we know? We know that if we provide something that we in the United States call coordinated specialty care, people do better. So what is coordinated specialty care? It's a multi-element team-based intervention. And of course, as psychiatrists, we start with medication. Okay, so that is a critical part of the treatment. And lowest effective dose of antipsychotic medications. And as psychiatrists and medical people, we need to also watch overall health. That these individuals come to us, and they already have the beginnings of problems with metabolic issues and smoking, et cetera. Okay, so that's number one. But it is insufficient to just do medication only, and we have to work as a team with other clinicians and other providers. What are the other elements? Again, this is evidence-based. We have individual cognitive behaviorally oriented therapy, so helping people cope with what has happened to them, develop coping skills, really addressing the trauma. How do you think about yourself? So psychotherapy. We have family support and education. Families are the ones that often bring people to care, that are the ones that have noticed the problems and that are supporting individuals. And families need support. I can tell you from firsthand experience that it's a terrifying thing to happen to a family. Most people don't know what this is, don't know what it's about. So so we have individual therapy, family support and education. We have case management. Sometimes people need help with just sort of, the day-to-day lives, particularly if they're poor or they don't have, access to good housing, et cetera. So we provide case management. And last, but certainly not least, is something that we call supported employment and education. And that is someone who works with the individual to focus on helping that individual, if they're in school, staying in school, if they're working, staying in work, to the best of their ability. Now, it may mean that someone was taking a full caseload in college, and maybe they take a few less courses. It may, and so it's not this support around employment isn't just blind to the issues and the challenges and the sometimes the heartbreak of dealing with psychosis. But what we know is with the proper kinds of employment and education supports, people can really stay on track. And that's why we call On Track New York, On Track New York. We have to deal with substance use issues, we have to deal with suicide prevention, but the bottom line is and no one of these treatments or one of these components is more important than the other. I mean, we have to deliver the package, and we do it using shared decision making. So the individuals can work with the clinical teams and sort of figure out, well, you know what, I don't think I can do the supported employment education today, but maybe next month, and so that there's all these treatments are offered, and then there's dialogue and conversation and trying to help engage people. That in fact, so I'll say one other thing about this, and maybe this is that the most important thing, the hardest thing in certain ways, in providing care to young people with early psychosis and their families, is engaging them. When this happens to people, they often don't know what it is. They don't recognize it. They have no experience with it, and they don't wake up saying, I think I better go see a psychiatrist. That's not how it happens at all. So what we have to do is we have to go to where the person is, both psychologically, emotionally, and sometimes actually physically, and make treatment something that the individuals actually want. And we do that, again, by listening, by empowering, by trying to help understand, by trying to provide care for the problem that the person thinks they have. They may not think they have a problem with psychosis or schizophrenia. They may think that what's most pressing to them is that they're having a problem with their girlfriend or they're not doing as well at school. So we have to try to offer this package of services, but we have to, the conversation, the dialogue has to be engaging and delivered and offered in the context of how the person defines the problem. And so we have to listen.
You mentioned that programs like On Track really now exist around the country, and for clinicians who are interested or want to do a more robust job offering a multimodal set of services, how can they access some of this information, and is there funding available?
Sure. Well, as a result of all of these players and participants in this new movement coming together, including, again, researchers, advocates, and government, the federal government has actually added money to the Community Mental Health Block Grant for every state. So every state has money, additional new money, that needs to be used to provide evidence-based early psychosis services. So whatever state you're in, whatever psychiatrists or all the psychiatrists who are listening, there's a first episode psychosis program or approach that's being developed now, and different states have are different phases of development. In New York State, we've really tried to make this available throughout the state,
Can you share a little bit of that experience? Because watching your program ramp up over just a few years, last I heard you're reaching thousands of families across the entire state. How'd you do that so quickly?
We did it with the support of the Office of Mental Health and New York State, city, counties. And so the money that came through the block grant, as well as additional state dollars, were put into building programs in different communities. My group at On Track Central, that's what we call ourselves, we are tasked with providing the training and the ongoing monitoring so that the program is delivered in an evidence-based way. And this program is staffed by clinicians, psychiatrists, social workers, psychologists, and now we actually have peers on each team, in different communities throughout the state. And one thing I would say is that the clinicians and the psychiatrists, everybody delivering this service, they love it. They love it. It's so rewarding because you see people just almost, recovering to some extent before your eyes. And obviously, there's a heterogeneous response to this intervention. Everybody doesn't get well, but when you see someone who's been so struggling and so in pain, and then 3 months later they're going to the prom, or they're graduating from high school or graduating from college, it's so satisfying, and I think teaches the clinicians that again we can do this. And with our patients and their families, we can do this.
It also seems peer support is such a great common sense way to help engage patients, but also it strikes me that it gives an opportunity for patients who get into recovery from their psychotic illnesses to potentially give back and help.
Exactly, yeah. And I think the promise and the opportunities afforded by having peer supporters, peers on the teams is something that we're even just now beginning to realize. And certainly many patients or many individuals with early onset schizophrenia or early schizophrenia, the opportunity to talk to somebody who's been through it, who can tell them how they coped, who can reflect a little bit on their experience. And we know this isn't just in first episode, this is really throughout the treatment system. But I think it's really especially valuable in early psychosis care.
We've talked about early psychosis and the ways that clinicians need to do a better job. What I'm hearing is intervene early, get help in developing or engaging in multimodal systems of care that provide a real robust set of wraparound services. It sounds like there's more funding for this than really there ever has been. And because of there are certainly breakthroughs happening in psychosis and schizophrenia research, but there's another breakthrough in terms of the services and the coordinations of services that can be employed by psychiatrists to get their patients fully into recovery.
Yeah, and I think that, again, every state, if you just go into Google and you Google whatever state you're in, early psychosis program, I guarantee you something will come up that you can use to make a referral or to learn what's happening in your own community.
Thank you everyone for joining us. If you have questions about coordinated care, go to Google or check out the Center for Practice Innovation or the great journal that Dr. Dixon is the editor of Psychiatric Services. You're also active on social on Twitter, and a great person to keep track of if this is part of the patient population you're taking care of. I'm Dr. Drew Ramsey for Medscape and Columbia Psychiatry. We'll see you soon.